just give it 5 seconds to make sure it doesn't show me that it's resetting. Okay, I think we're good. We're good.
Okay. Thanks very much for joining us on a presentation regarding communication changes in dementia. My name is Sarah Harlock, and I'm the Program Director for the Integrative Center for Memory at Dent Neurologic Institute. I'd like to start by defining some terms and making sure that we are all on the same page when we are using these terms. We very frequently see that people will bat about terms like dementia, Alzheimer's, and memory loss and use them interchangeably. And they can mean very different things. Dementia is a term that really describes a group of symptoms. Those symptoms could include memory loss, but they might also include difficulty with language, challenges in planning or problem solving, difficulty with visual spatial images, changes in concentration or focus, and even personality changes can be a symptom of dementia. There are many things that can cause dementia. Some of them are reversible, many are not. Some of the things that cause dementia that are reversible include infections like a pneumonia or urinary tract infection. They can certainly create symptoms of dementia. Also, thyroid issues, vitamin deficiencies, malnutrition or dehydration, these can all create these symptoms of dementia. So if things are caught early enough, they can be reversed and people will go back to their baseline. Most frequently, when we're talking about dementia, we are talking about those conditions that are not reversible. Those include things like Alzheimer's disease, vascular changes causing dementia, Creutzfeldt-Jakob, frontal temporal disorders, Lewy body. There are many, many things that cause dementia. And I want people to be aware that there is a tremendous amount of research going on nationally, but also internationally. And there is a great reason for hope, as there is just all kinds of information that we are learning more and more about dementia and effective treatments and ways to prevent or reduce our risk. So lots of reasons to be very hopeful. But today we're going to really focus on communication, and what communication really is a way of imparting or exchanging information. It's a way of connecting people. And so when we think about it that way, it's important that we also be thinking about the various changes that dementia causes that can impact communication. A lot of times we'll think about communication as verbal and language-based, but there's a lot of communication that happens outside of that. And so it's important to be thinking about how dementia changes the brain and how dementia changes or can impact other senses that can affect communication. So as far as visual changes go, people with dementia, different types of dementia are a little different, but people with dementia may experience changes with depth perception. They may also experience changes in their peripheral vision. And that can really impact things. For example, if you were to put somebody's medication right in front of them, but their field of vision is not including that sort of peripheral up close line of sight, they may not see that their medication is there. Or if you were to come up on the side of somebody and they didn't hear you come up beside them and all of a sudden you said, "Hi, Mom," it might startle them because they don't have the peripheral vision to see you coming up on the side. You think you're in their line of sight, but you really may not be. So that can create some challenges in communication if they're not seeing that you're there. Auditory changes, certainly if somebody is hard of hearing, it can impact their ability to comprehend what's being said. It's much more difficult for people to make sense of what's being said if their hearing is impaired. But some people with dementia also have difficulty differentiating between noises that are right in front of them and background noises. And so everything just sort of starts to get muddled. It's difficult to pull out the conversation that's happening right in front of you because there's some background noise, either a television or another conversation going on. So again, those auditory changes can also impact our communication. The sensory changes can include things like touch. If somebody has some neuropathy or lack of feeling or pins and needles feelings in their extremities, that can certainly change as you're handing somebody something they may not, or you want them to take part in something. They may not be able to actually sense this through their fingertips, feel the object through their fingertips. And the other is heat and cold. They may not be sensing heat and cold quite the same way. And so they may feel something as cold, whereas you think it might actually be quite warm. So again, thinking about in conversation or in communicating, just remember that their sensory experience may be a little different than yours. Processing time is another piece of this puzzle, if you will, that can certainly change with dementia. It is not uncommon at all for people to require more time for processing. And it's certainly not uncommon for people to take up to 90 seconds to take in the information, think about an answer, formulate that answer, and then produce that answer. So I just waited 5 seconds. If that were somebody with a more moderate level of dementia, you could expect that it would take much more than 5 seconds to come up with a response. And yet that 5 seconds can seem pretty long. So again, think about the processing time. We very frequently will ask a question, and if somebody doesn't answer us right away, we then ask it again. And what we may need to be considering is that we need to give them more time for processing those answers and coming up with their own conclusions and so on. So again, we want to be very mindful that people with dementia take more time to process and formulate their answers and come back with an answer for us. Language changes certainly impact communication. And so you need to be mindful that people may have difficulty coming up with words, or they may substitute words. And again, sometimes it takes a little bit of effort on the part of the listener to interpret what is said. So if somebody with dementia is using words and they're not necessarily following an order, perhaps they have aphasia, so difficulty with language. They may be either having difficulty getting the words out, or they may actually be having difficulty taking those words in. So actually taking that information and being able to understand the language. So language problems can happen in both directions. Also important to be thinking about emotional changes and how that might be able to affect communication as well. If somebody is highly anxious or very irritable, they're not going to be in the same frame of mind as an individual who is calm and relaxed and comfortable. So again, when we're talking about communication, we want to be paying attention to the emotional changes or the emotional state of the person with dementia. As I mentioned, a lot of times when we think about communication, we're really only focused on the verbal communication, but there's a lot more to communication than just verbal. When we are talking about verbal communication, though, I think it's important that we talk about word choice and the intention. And if you use a sentence like, "Can you close the door?" and you put the emphasis on different words, it can change the meaning of that sentence completely. So if you said, "Can you close the door?" probably means that somebody's looking for you to close the door. If you said, "Can you close the door?" it means that they are looking for that person specifically to close the door. But if you said, "Can you close the door?" or if you say it with a little more attitude, it can mean something very different. I mean, obviously they still want the door closed, but the intention and the tone that is used really can affect how that communication is interpreted. And so we want to be very careful about word choice and intention. So another thing to be considering is the speed of our speech. Particularly in the Northeast and other parts of the country too, we do have a tendency to speak very quickly. Other parts of the country, people speak slower. For somebody who has dementia, a slower speech pattern is much more helpful to them. It allows them time to process what is being said. And so you want to think about how quickly you speak and think about slowing it down. It's very, very common for people with dementia to revert to their first language. And so if they grew up speaking another language, they may actually end up reverting back to that language. Even if they've learned a second language along the way, they may revert back to that first language and have more difficulty with that second language that they learned. I think it's also important to be thinking about slang. We use terms pretty commonly, and again, somebody who doesn't have dementia may not have any difficulty with some of those terms. If dementia is to develop, then they may have some difficulty understanding what those terms mean. For example, if you had somebody who was very tech savvy and they use their computer regularly or their smartphone or tablet, and they use Google to search, you can use terms like, or sentences like, "Well, just Google it," and they'll know what you mean. But if dementia were to develop, there may come a point where that term doesn't mean anything to them. And so again, just thinking about slang and how we use slang, it may change over time as dementia changes. Tone of voice, I'd mentioned earlier with the "Can you close the door?" certainly matters. And again, you want to be really careful about your tone of voice. You want it to be reflective of what it is that you'd like this person to do. If you are trying to get someone to take medication, for example, then you want to make sure that your tone of voice is positive and again, reflective of what it is that you are hoping to communicate. So tone of voice matters quite a bit. Volume also matters, and as we age, a lot of people do experience hearing loss, and very frequently it's also the higher pitches, so female voices very frequently become difficult to hear, and that's important to pay attention to as well. And maybe what you do is you think about, consciously trying to lower the pitch of your voice if somebody is having some difficulty hearing you. So volume and pitch can really play a big role in communication. And old communication styles and patterns really can change with dementia. I had a conversation with a woman who was caring for her husband, and communication was a big challenge for her. And we discussed a little bit about what their typical communication pattern was like. And it turns out that they had a very friendly but jousting kind of communication pattern. They would kind of give a jab at one, and the deal was that the other one gave a jab back. That was just their standard communication style. And it wasn't malicious, and it was understood that one gives a jab and the other one gives a little jab back. And that was just the way they communicated. Not right, not wrong, that's just the way they did it. And what happened was, as her husband developed dementia, he forgot that rule, and he forgot and started to misinterpret her jab. And so while she was jabbing, expecting him to jab back as he had for 30 years, all of a sudden he was not understanding that part of it. And she would give her little jab and he would say, "What did I do wrong?" He was completely misinterpreting what she was doing. So she had to actually change the communication pattern. So think about these things. If you are having difficulty with communication, you want to think about your word choice, and you want to think about the speed at which you're speaking. You want to think about slang. Is that part of the problem? Tone and pitch. Is the person actually having trouble? Tone of voice. Is the person interpreting something that you didn't mean to be there in your tone? But volume and pitch. Is the person actually having difficulty hearing you? And communication styles. So again, it's not that I think you need to go home and rearrange all of your communication, but rather, if you are starting to notice some challenges in communication, then you want to think about some of these things and see if these may be playing a role in the communication problems. Nonverbal communication plays a really big role in our communication as well. So, well, again, we think about communication as a verbal process. It's actually much more than that. So when we're talking about nonverbal communication, we want to talk about facial expressions. When language becomes difficult for someone with dementia, they start to use other cues, and facial expression is one of them. They can pick up on whether this is something that that's going to be a positive experience, or whether this is something that they should be concerned about, whether or not they should be just relaxed about. So again, if language is starting to become difficult, people with dementia will start to use other cues like facial expression. They'll also use body language and watch for the cues in body language. And so again, we need to be very mindful that our body language and facial expressions are depicting what we want and reflecting what we want people to pick up in our communication. I was working with a woman who was caring for her mother, who was very late stage dementia, and she needed personal care, and the patient did not care for that experience. It was difficult and embarrassing, and she would strike out, honestly, at her daughter when her daughter tried to perform personal care. Partway through our meeting, the daughter had to excuse herself to go and help her mother. And as she was entering her mother's room, she stopped at the door and she took a great big breath, and her shoulders went back, and she created this very imposing figure, one that actually looked rather aggressive. She had a stern look on her face because she knew she was going into a difficult situation. She had puffed out her chest. She had her shoulders back. Her arms were to her side, but not loose at her side. They were kind of tense. And she was creating this very aggressive looking figure. And so, we stopped right there and sort of talked about what was going on there, and the fact that that might actually be triggering some of her mother's problems with personal care, is that if the patient is not picking up on language, they may very well be picking up on this imposing figure coming at them. And so again, we want to stop and pay attention to what our body language is actually expressing. Another part of nonverbal communication are gestures. And so again, if language is difficult, we can help people sometimes with instructions if we are using gestures. If you want somebody to sit in the chair, you can make the motion of sitting so that they see what it is that you want them to do. Likewise, if you wanted them to take their medications, you can pretend you're tipping a cup up to your mouth to take a sip. So again, using gestures can be very helpful. Touch is important because it helps bring their attention to you as you start your communication. And making sure that you're in somebody's line of sight is really important as well. Again, it helps them see the facial expression, the body language, all of those sorts of things, and brings their attention to you if you're in their line of sight. And then using a calm, gentle approach is another really important communication technique for nonverbal communication. So these techniques that we're going to talk about really depend on the people involved in this scenario. So for example, if we have a patient who has very mild symptoms and perhaps very early stage, you want to be careful about how you use these techniques. It isn't a one-size-fits-all. And again, this goes back to my earlier statement that you don't have to start implementing all of these techniques if you're not having problems with communication. It's if you are starting to see some challenges in communication, then you want to think about some of these choices and maybe implement a couple of these different techniques. So again, effective communication techniques, we want to speak slowly, calmly, and clearly so that we give people the best chance of hearing us and understanding us. Another approach is to give only one instruction or ask only one question at a time. Again, we very frequently will give lots of instruction or ask 3 questions in one sentence almost. And so again, maybe just one at a time is more appropriate for the individual. You want to allow that time for the response. And again, remembering that sometimes it takes up to 90 seconds for people with dementia to take information in, process or formulate an answer, and then get that response back out to us. So rather than asking the question again when they don't answer in 5 seconds, or asking it again and louder, really we want to step back and make sure that we're giving this person enough time to process and give them enough time to respond in their own time. So again, try not to say things repeatedly, and unless you really get the impression that they didn't hear you or that they need you to repeat that question. It's very common for us to say, no, no, don't do that, or don't do this. And what I would encourage caregivers to think about is, rather than telling people what not to do, tell them what you want them to do. So instead of, if somebody were to be heading for the door and you don't want them to go outside because they don't have proper footwear on, instead of saying, no, no, don't go, try saying something like, could you come and help me? Could you come this way? Would you like a glass of water? But, you know, sort of distract them away from what it is that that you don't want them to do, and focus on what you do want them to do. Again, just through the course of the day, they may hear the word no far more frequently than we intend to say it. So try to avoid using that. Again, that goes back to telling them what you would like them to do rather than what you don't want them to do. Again, try and simplify the communication. We don't always help the situation when we add extra adjectives or expand on things. Try to keep the language very simple. Use gestures and match that body language and facial expression with the desired response. If you have somebody that you are trying to have them take their medication, and you have a sour look on your face and you've got your hand on your hip and you're tapping your foot, then they're not going to necessarily think this is a really great experience. So if they don't understand the language, they're going to pick up on that facial expression, body language, and it's not going to look like a good time. So again, you want to approach smile and relaxed, not trying to rush them. And I know that's difficult sometimes. Sometimes you're truly in a rush. But the less you rush the patient, the more successful you will be. So again, matching that body language, facial expression with the desired response. And just be mindful of that. So there are several different techniques and models of communication, and so we'll go through a few of them. Reality orientation is something that that was used very frequently in dementia care many decades ago. There are times when reality orientation is still very appropriate. And again, I'm thinking of people in the early stages who maybe just have gotten a little confused temporarily, and they need that sort of nudge to remind them that that something is not as they're imagining it right now. So it really, reality orientation tries to bring a person with dementia into our reality. And so you're clarifying for them. You are saying that this is so, rather than some of our other approaches. So it's really just sort of bringing somebody back to reality, or at least attempting to. Therapeutic fibbing is another technique that's used, and some people have a lot of difficulty with this, but I look at it really as we are entering somebody else's reality. So rather than trying to pull the patient into our reality, what we're doing with therapeutic fibbing is entering their reality. I had worked in a nursing home, and there was a woman who was very upset, and the staff member who was with her was taking her in her wheelchair around the building and trying to calm her down. And she saw me, and she said, honey, I really have to get going now, and my mother's going to be worried about me. And clearly her mother was no longer with us, but she was very convinced that she needed to leave and that her mother was going to be concerned that she wasn't home. And when I got close to her, I made eye contact, her hand, so that she was focused on me, and I told her that I had spoken to her mother, and her mother had said that she should stay here for dinner. And she just relaxed immediately. You know you're doing the right thing when you can visibly watch that relaxation just wash over her. And that's exactly what happened. So a lot of people do have difficulty with this concept of not telling people the truth, telling her that I'd talked to her mother when her mother had passed away many decades before. People really do have some difficulty with that. But what I was doing or trying to do was entering her reality and giving her an answer that would make her feel better. So that's the concept behind therapeutic fibbing. There's another technique called validation. And this is a way of acknowledging the emotion behind a behavior. And I really like validation. I think that it can be very effective. But basically, you're going to the emotion that somebody is feeling. So rather than being focused on the problem, you're looking at the emotion behind that problem. And we're going to get into an example here. And then there's also a technique called Aikido communication. Aikido is actually a martial art form. And that is a method of martial arts that uses the energy of the opponent to find to move the situation forward. So in Aikido communication, it's really a great technique for problem solving and using the energy of the situation to find common ground. So aligning yourself with another person's energy to decrease an argument or find common ground. So I want to use an example and I actually already did, that example of the person saying, I need to go home now. My mother's going to be looking for me. It's time to go. You need to take me home. That's something that people with dementia very frequently experience, and they sort of move back in time, and they think that that they're much younger than they are. And so this expression is something that people caregiving may hear, and be prepared for that. But using the different techniques, if you were to use reality orientation, you might say something like, June, this is your home. You don't have to go anywhere. And again, if somebody were in the early stages and having a moment of confusion, this technique might be effective. For people who are in the later stages, the moderate stage to late stage, this technique might actually just escalate the situation. In their mind, it's very real. And so, again, by telling them that they are wrong, that this is their home, they are home, it can actually just escalate the situation and increase their anxiety. So you want to be careful about using reality orientation. It may be effective in the early stages. It may be less effective in the middle to late stages. The therapeutic fibbing technique is, as I had explained in that previous example, you might say something like, June, I spoke with your mother and she said you should stay here for dinner. Or you could say something like, I spoke to your mother, she's playing cards with the ladies and she'll be home for dinner. Why don't you come on with me? So again, it's this idea of entering their reality. Using the validation technique, you wouldn't tell her that you spoke to her mother, but instead you would say, tell me about your home. Where is it? Or tell me about your mother. What do you miss about your mother? And again, you're getting at the emotion behind the statement rather than the statement itself. And the idea with this validation technique is that eventually you can get this person to acknowledge or understand that they are where they need to be, or that their mother maybe isn't with them anymore. It's a good technique, and I like the idea of certainly validating how this person is feeling, but it can be very time consuming. And so from that perspective, it's not always appropriate to use. So again, a great technique. I like the idea of letting people know that they've been heard and validating their feelings. But again, it may not always, there may not be enough time to always use this technique to get to where you need to be. The Aikido communication technique doesn't work well in this example so much because it's really more for problem solving. But the steps that you would take in Aikido communication are to align. So again, making sure that this person knows that you've heard the emotion behind the statement. And then you want to agree with them so that that they feel that there is some room to come to a solution. Redirect them and then try to resolve. What Aikido communication is trying to do is stop you from being defensive. So if somebody were to say, well, you're really bossy and you always take over everything, this is a much better example for Aikido communication. So if that were the scenario, then for Aikido, you would want to align. And you would want to say something like, I understand that, or I can sense that you're really feeling upset about this. And then you want to agree with them and say, I agree, we maybe need to work on this communication. I'm trying to help you. So let's talk about what we can do. So redirecting is saying something along the lines of, we both want this to go smoothly. And I want you to feel comfortable with the decisions that are being made. And then resolving, you would say something along the lines of, perhaps when I'm making decisions, we need to sit down and talk about the decisions before I actually make them. And so this idea of aligning, agreeing, redirecting, and resolving can be very helpful in problem solving. And again, it's just sort of to stop you from throwing up that barrier of, well, I have to make the decisions. If the person says you're bossy and you're making all the decisions for me, sometimes it's very easy to become defensive and just say, well, I have to. I'm the only one who can. That stops the communication right there. So by using the Aikido approaches, it can actually be very effective at opening up that communication and not putting up a wall between the two of you. So I know that's 4 steps. It might be hard to remember all 4 steps, especially when your emotions get involved. But if you can at least, align and agree, you'll start to learn that process. And so, make sure that person knows that they've been heard, and make sure that you're agreeing that the situation is obviously upsetting to them, and that together you can come up with a solution. And then redirect and resolve. So it takes some practice. There's absolutely no question. We all have some triggers, and we all have some communication patterns that we've developed over decades. And so learning these new techniques, whether it's Aikido or whether it's therapeutic fibbing or validation, this all takes some practice. There's absolutely no question about that. So when we're talking about communication, here are some simple do's. Validate their responses. Make sure that people know that they are being heard. That sometimes is all you need to de-escalate the emotion in a situation. Use short, simple sentences. Establish that eye contact, and sometimes that means that you have to crouch down, or make sure that you're not expecting them to be looking up at you. Again, that's also a communication technique, is make sure you lower yourself to their eye level. Nod your head for agreement. Again, using those gestures can really help with understanding. Don't forget to smile. Use touch gently. And forgive yourself. This is, again, something that is going to take some practice. And again, you're not going to get it all right all the time. So forgive yourself when you slip into an old communication pattern, or when you find yourself getting a little defensive because you've been yelled at for something you didn't do. It's important that you forgive yourself. The don'ts are things like, don't approach in anger or impatience. If you need to walk away from the situation to calm yourself down, then do it. If you rush somebody, if you act really impatient, you're going to have a much less effective result. So don't rush the person. Try not to ask questions that require short-term memory. I've talked to a lot of people who will pick up their loved one at a day program, and the first thing they ask them is, so what'd you do today? The problem is the person with dementia may not recall what they did. And so for that reason, they'll say, well, I didn't do anything. And that just seems to upset a lot of the caregivers. And so again, let's not ask questions that require short-term memory if short-term memory is the big challenge for the patient. Try not to give too many choices. Sometimes we try to do our best by offering choices and the opportunity for control and decision making, but if we give too many choices, sometimes that becomes very difficult and overwhelming for the person with dementia. So maybe you still want to give them control and decision making power, but you limit it to 2 things. So instead of saying, what would you like for dinner? Ask, would you like chicken and salad, or would you like beef stroganoff? And give them 2 specific choices to make their decision. Try not to argue or confront the person with dementia. It tends to really escalate, obviously, the situation. And the other negative piece of this is that even after the argument is over, the person with dementia may actually carry the emotion of the interaction with them. So they may be in a bad mood, even though the argument has been resolved. The other thing that can happen sometimes is that the person with dementia may completely forget that there was an argument. They may walk out of the room and walk back in 10 minutes later, and they have forgotten that it happened, but the caregiver has not. And the caregiver may still have high blood pressure and be stewing over this situation, but the person with dementia doesn't understand why the caregiver's upset. So again, try not to argue or confront the patient with dementia. It usually is not very effective for communication. Try not to talk about them in front of them. This becomes difficult in some situations. I'm thinking specifically of the doctor's office. We need to know in the clinical setting, we need to know what's going on, but there are other ways of letting us know without necessarily revealing embarrassing information in front of the patient. You can always call the clinic the day before or use a patient portal to relay that information. So any of the changes that you're seeing or any of the concerns that you may have. You can also write down your top 3 concerns and put that on a piece of paper and slide that to the medical assistant or whoever is taking you into the room. And they'll make sure that those questions get to the provider, the nurse practitioner, or the physician before they come in and see you. So there are ways of talking and letting the clinic know what's going on or what concerns you have without necessarily talking about the person in front of them. I also worked with a daughter who said, my mom is really paranoid. And I said, well, tell me about it. And she said, well, every time I go over to to my mother's house, my mother thinks that my sister and I are talking about her. And so anytime my sister and I go into another room, my mother is following us. And I said, well, are you talking about her? And she said, well, yes, it's the only time we have to talk. And I said, your mother's not paranoid. Your mother's perceptive. So again, it's trying not to talk about the patient in front of them. That information probably could have been shared over a phone call separately. And it makes the patient uncomfortable. So again, just be mindful about talking about them in front of them. Try not to talk louder if they don't necessarily respond or they don't understand immediately. Again, we talked about that before, that processing time expands as the dementia progresses. And so we need to give people time to respond to the question that's being asked. And then try not to reason with them, because the person with dementia may have a tremendous difficulty with being rational. A lot of times the arguments or conversations that they are having are very emotional to them. And so it's important that we try not to reason with them if they're not in a state that we can. So again, just be mindful of that. And again, a lot of times caregivers will ask me, is this the right thing to do? And it's not really about right or wrong. It's really about effective or not effective. If what you're doing is working, then keep it up. If you're noticing that there are difficulties, then you may want to implement some of these changes. It's important to have realistic expectations. The person with dementia may not be capable of deliberately changing their communication anymore. So it's important that we not be trying to repeat or rationalize or argue or, any of these inappropriate or ineffective techniques, because the person with dementia is not going to learn from the experience. Again, especially if short-term memory is the challenge, it becomes difficult for them to try and learn new information. So caregivers need to be mindful and think that, or recognize that they are the ones that may need to be changing rather than expecting the person with dementia to change. And then finally, I just think it's really important that you be gentle with yourself. There is no need for you to be perfect. And so really, I think you need to have realistic expectations. I haven't yet met a person who is perfect in their communication. And we all have those days where we fumble for words, or we put our foot in our mouth, or we're just not in the best state of mind. And so things come out not the way we intended them to. And so recognize that when you are communicating with an individual with dementia, you're going to have those days too. And just have realistic expectations for yourself. Just try and forgive yourself if you do make a mistake and move forward. So there are many, many aspects of communication. These are just some of them. And I would encourage you again to just start trying some of these techniques if you are noticing that communication is becoming more difficult. Thanks very much for joining me, and I hope you have a great day.